Agarwal, mom of two, and the Instagram influencer, also a mommy content creator with the name of Angel's Mommy 15. I am happy that the Dr. Shilpi Reddy have joined the session to discuss a really important topic, signs and symptoms of urinary tract infection. Before we begin, I want to give our audience a general insight into BabyChakra, what our platform is all about. BabyChakra is India's largest pregnancy platform. It is a one-stop destination for pregnant women and expecting parents. We try to connect parents with experts who bring valuable information and research-based information to all. On that note, I would like to kickstart our topic for today. We are going to have an informative discussion today on signs and symptoms of urinary tract infection. We have an amazing lineup of guest speakers with us. On board, Dr. Shilpi Reddy, can you please introduce yourself?
Hello all, this is Dr. Shilpi Reddy. I'm an obstetrician and gynecologist at KIMS Cardinals Mother and Child Center, Hyderabad. And I am a passionate doctor for women's health. I'm a specialist in giving one-on-one care, and my area of interest is high-risk pregnancy and complicated, cases in gynecology.
Thank you for joining us today and sparing some time to bring lots of useful and helpful information to our viewers.
Thank you. It's my pleasure.
Urinary tract infection affect our urinary tract, including your bladder, urethra, or kidneys. Infection usually occurs in a retrograde ascending fashion from the bladder, but it may occur hematogenously. Let's understand more about this very common issue. Let us discuss the best way to indulge in the conversation with our experts in the panel today. We'll address this topic in depth. We shall begin with a few questions. Dr. Shilpi, what are the signs and symptoms of UTIs?
Usually, women have pain during urination. They have increased frequency of urination. They also have, abdominal cramps, pain, and sometimes if there is infection concomitantly in the vagina and the urine, then definitely both the symptoms are together there.
Okay, thank you so much. And how is UTI being treated? Like basic?
Yes, in terms of treatment of urinary tract infections, there should be a very, stringent criteria. First, do the urine examination, urine culture, and then start the treatment. We have community antibiotics which usually work for urine infections. If there is no fever, then that's fine. We can wait for the reports to come in, increase liquids, increase, symptomatic medications if there is any problem, and then wait for the culture report and then start the correct antibiotic, that is culture specific antibiotic. But if there are severe symptoms, then we don't wait until the culture specific report comes in. We start away with urinary specific antibiotics like nitrofurantoin, like ofloxacin and all, depending on what age group the woman is, whether the woman is pregnant, non-pregnant. All these vary a lot in terms of starting an antibiotic also.
Okay, thank you so much, doctor. What is the most common cause of that infection?
In women, urinary tract infections are very common because of the short urethra. Urethra is the outlet from the bladder to the exterior. So when there is short urethra, the kind of ascending infections that come from outside to inside are very, very high. And over on top of that, women do look in for places which are comfortable to voiding of urine. They hold urine for a very long time. They get scared drinking a lot of water because if they don't have washrooms around, it'll be difficult. So daily practices are also there. And again, hygiene related lapses can also be there. And when you're using a lot of public toilets and all, ascending infections can be common. Again, your immunity, if it is low, if you have low vitamin D levels and if your immune system is low, again, infections catching up is very, very high. And you can have urine infections in kidney stones, in certain, problems of the urinary bladder, in certain problems of the kidneys also.
Okay, thank you, doctor. So does drinking water may provide some relief from urinary tract infection?
Yes. If you are good at having good amount of water, especially in the place that you are. If it requires more hydration, yes, you have to drink a lot of water. And the season that you are, if it requires more amount of water, you should drink that much of water. But if you're working with your body against seasonal changes and places that you are living in, then definitely dehydration can cause urine infections very frequently. And the severity of infections also can be very high, specifically because your body will not be able to cope up with dehydration. There's so many toxins in the body that usually are let out through the urine, and if any infection catches up there, it is little difficult to get rid of it if your habits are not good.
Okay. Thank you so much. Doctor, is UTI normal during pregnancy?
Yes, UTIs are common during pregnancy, but it does not apply to everybody. But since the urethra is short and the pregnant uterus is just next to the bladder, and there is so much of frequency because of pressure, there is handling of both the organs next to each other, you can still have an increased incidence of urinary infection. The reasons can be plenty. The organs are next to each other, the immunity in pregnancy is little low, and the pressure is there on more on the bladder area. And sometimes if you're using more number of times washroom, also the kind of infections can creep in. And if you're working at some place and you're infrequently voiding urine, that can also be one of the reason why infections come in. But yes, pregnant women have a higher incidence of urinary tract infections, and screening for urine infections is very very important in pregnancy. I have a protocol wherein once the first checkups itself, we check the urine examination. Then at least at the end of one trimester, I usually check for cultures just to identify subclinical infections. That means which are not evident outside, and then treat them so that they don't be a cause of concern for labor and preterm delivery.
Okay. Okay. So, what are the things to avoid to protect ourselves from that UTI?
It's very simple to protect yourself from UTI. Your health habits should be good, your washroom etiquette should be good, and cleanliness and hygiene is one part of it. Your immunity levels should be good. Not only that, whenever you're having, whenever you're according to your environment needs, according to your body needs, have good amount of water and good amount of foods that are loaded with water content. And regular voiding of urine is important. Holding of urine for a long time also can be one of the reason why urine tract infections are there, and they don't go also in such conditions.
Okay, thank you so much, doctor. One more question. In the last question, I want to ask you, what are the foods to avoid if a woman is suffering from UTI?
Any foods that can cause dehydration, spicy foods, especially when there is urine infection, they can have a lot of nausea also. The vomiting sensation feeling is there, they're on any antibiotic and some painkillers, then acidity also can be there. So they should be having some simple foods, and they should not be having some spicy, complex foods which are hard to digest. It's very important that simple foods, hydrating foods, like soups, like juice, or liquids like ganji and barley water kind of a thing can be taken. And fruits also have lots of water in them. Cucumber also has a lot of water in them, so foods resembling cooling properties should be given to the body.
Thank you so much. Thanks a lot, doctor, for joining us today. The tips you have provided are extremely helpful, and I'm sure all the mommy and daddies will find them useful too. With that, we come to the end of our live session today. Thanks to our wonderful viewers who joined us today, and thank you, experts, for sharing so many helpful pointers to us. And do keep following us on BabyChakra and stay tuned for more helpful parenting videos and tips. And do follow me also on Instagram, Angels Mommy 15. My handle is Angels underscore Mommy 15 to see our daily lives and some parenting tips. Thank you so much.